Good morning, and welcome to another edition of Your Health at Home. I'm Kevin Dano, Administrator for Westminster Canterbury Richmond at Home, and I have a special guest with me today. I don't think she's a stranger to many of you watching, although she is in a new role, leading out a new position here at Westminster Canterbury, which will help facilitate health services for all the residents here, not only home health and hospice, but especially those who may have to go off campus for a hospital stay or a prolonged procedure or something of that nature. It's my honor to introduce to you Tracy Terrell. Tracy, thanks for coming in. And I think you've been here for quite some time. How many years?
13 years.
So I think a lot of people out there, most people will know Tracy. But Tracy, for those who don't, can you give us a little bit of your background?
Yes, I finished LPN school in 1990. I went to nursing school at St. Mary's School of Practical Nursing. And from there I worked for a doctor with family practice. Then I went to long-term care, worked for a cardiologist and pain management, and now I'm with home health.
Wow. And prior to coming into the home health department, you were here in the clinic?
Yes, I started working here in 2007. I've worked in assisted living and the independent living clinic.
So you have a good idea and maybe your finger on the pulse of a lot of the issues faced by the residents day in and day out here at Westminster Canterbury.
Yes.
Sounds like that. So clinical nurse liaison sounds like a fancy position, fancy title. What is a nurse liaison? What's your role? What do you do?
I will be going to the hospital and following the resident throughout their entire stay at the hospital to coordinate and plan their care when they return back to Westminster Canterbury, so that we can be prepared to meet their needs.
Has that been, up until this point, or maybe this position, an area that we've struggled with? Maybe you've seen it in the clinic or in other departments where residents are going out either for planned or unplanned hospital stays, and then kind of we lose contact? Or tell me a little bit about why this is important and how this is going to help them as well as help us help them.
There has been times when I was working in the clinic that someone returned from the hospital and the staff in the clinic was unaware that they had returned.
Okay.
So this role will prevent this. By keeping in continuous contact with the resident and their family and visiting the resident in the hospital, we will be able to, follow their care and know exactly when they're going to return and acquire all the medical information needed so that when they return we can have a plan of care and meet their needs.
Now, this is primarily for the home health patients, but it also serves for other residents who may not be on home health. Is that correct?
Yes, because when I visit someone in the hospital, I will check on them, see how they're doing, and I will follow up with the nurse and case manager. And by discussing their medical condition and finding out what their needs are when they return home, then I also keep the Westminster Canterbury staff informed of this.
That's great. And what about the patients themselves when they're there, their family? Are they finding it of value? I know we've been doing it for about a month or so now. What's kind of been the feedback, and what are you learning from being able to be an extension of the campus and a helping hand to them when they're there?
Well, for one, when I walk into their room and they see a familiar face, they're very surprised and very happy.
Great.
One of the residents that I visited recently at St. Mary's Hospital, I visited with her and she had some questions about a test that she was having done that day, and she wanted to know when she'd be returning home. So after following up with her nurse, I returned to her room, explained the test that she was having done, and that if the test results are normal, she could return back to her home this afternoon. She was very, she expressed that she felt cared for, and she really appreciated that extra support.
And I think that's probably something that is common for a lot of these patients, any of us who go into the hospital. We feel like we're kind of just put into this system, and to see your nurse or see your doctor is generally for a very short amount of time, and it always doesn't allow for you as the patient to be able to ask questions and find out about what's happening, and more importantly what it means, or maybe family members or so forth. So as a part of this service, are you you able to spend the time with the resident, talk to them maybe about the procedure they're having, answer questions and that sort of thing?
Yes, that's one of the things that I enjoy the most about this new position, is that I get to spend the one-on-one time with that person. And sometimes they may not understand what the doctor is saying to them, so I can explain it to them in a way they can understand it. And
That's
so I'm really happy to meet with the families and explain to them as well and answer questions for them.
Now, when we know, for example, we have residents who have what we call planned surgeries or planned procedures, does your office get in touch with them ahead of time to let them know you'll be checking in, or do they have a heads up you'll be coming and give them the opportunity to make a decision whether or not they want a representative there to help them advocate and answer questions?
Yes, I always reach out to the resident prior to their surgery to make sure, they have everything they need, and if they have any questions about their plan of care when they return, and if they're interested in home health, then I'll reach out to their doctor and get an order.
And what about if they aren't going to come on home health, but maybe they're going to return to, say, the health center or whatever? Are you able to facilitate information and medical jargon, if you would, to the health center so that they have everything they need for when the patient arrives?
Yes, I always call ahead of time to the doctor and get medical records, and I make sure that if they are not returning to their home and they are returning to healthcare, that I give that information to healthcare so they have it ahead of time.
So it sounds like you touch a lot of other healthcare providers in the process of helping support our residents. What are some of the challenges you have, and what are things that even the residents might be able to do if they know they're going in for a procedure that helps streamline the process so that their care is seamless from the time they get there to the time they return?
One of the things that I'm doing is asking the resident to sign a medical release prior to their procedure or surgery to make sure that we acquire all the medical information needed for their plan of care when they return.
And that's important. How come?
Because there's been times where someone's returned from an outpatient or inpatient hospital stay or procedure, and we may not have all the medical information we need. And sometimes when you call a doctor's office or the hospital, they're not willing to send you the information without a medical release. So to stay ahead of it and be proactive, I'm having the person sign a medical release prior to the procedure.
Okay. So it sounds like a pretty comprehensive service that we've expanded within the healthcare services arena here. Does it cost the resident anything for this, or is this strictly from Westminster Canterbury?
No. This service of visiting liaison is throughout.
Sort of part of the package or the advantage to being in this kind of environment.
Yes, it's a huge benefit for the resident and the whole healthcare system.
That's great. You know, one of the things that we've done in the short time that we've been operating at home, which is the home health and the hospice component, is we've begun to expand our services somewhat off campus as well, particularly to what we refer to as the Canterbury Club. These are individuals waiting for a spot to come in and become a resident of this campus. Is there plans, or are these liaison services available to them as well as part of coordinating their care?
Yes, we are prepared to serve the Canterbury Club with home health so we can meet their needs as well.
Okay, that sounds great. Well, there you have it. Another expanded service brought to you through Westminster Canterbury. As we continue to grow the at-home program, we continue to identify needs or gaps in services and fill them in with the appropriate healthcare professionals. And it's our sincere hope that this is another element that will help streamline healthcare for residents living here who need to go off campus into the healthcare system where they don't have necessarily a professional advocate or advisor or assistant, and to bring them back and continue their care seamlessly. So Tracy, we look forward to working for you, and thank you for taking this position and your time today to talk about it a little bit.
Thank you.
Thank you.